Hello, everyone. We're the biology group, and our presentation is focused on the many ways of helping others through healthcare. So, our mission statement is to address the physical, cognitive, and emotional healthcare needs of our community by providing excellent, compassionate, and accessible care while promoting the holistic well being of each individual by encouraging innovation, efficacious communication, and a lifelong journey of learning. The theorist we focused on was Erik Erikson and his theory on the 8 stages of psychosocial development. So Erikson identifies 8 stages based on age ranges, and he identifies a specific psychological conflict that shapes identity and growth within that stage. So I'm Zach. I'm a physical therapist assistant major. And my research was on finding innovative problem solving in healthcare, specifically physical therapy. So, a common issue in physical therapy is patients not completing exercises that are prescribed to them to perform at home as part of their plan of care. This is commonly attributed to issues of self efficacy, poor social support, or a feeling of helplessness. The research article I studied found that a creative solution to this problem is rather than prescribing traditional exercises to do at home, using game based exercises such as virtual reality while being supervised on a virtual call like Zoom with a physical therapy professional. Um, and this is an example of using an uncommon kind of new age technique to solve an age old problem, to better lives and provide better treatments for patients in physical therapy.
Hello, my name is Eric Floyd, and my career path is physical therapist assistant who specializes in multiple sclerosis physical therapy and the importance of physical activity and exercise to help with the symptoms of the disease and to help assist in living a better quality of life. And overall, within the healthcare industries, the importance of recognizing and emphasizing to patients that being physically active and exercising is important as well. Wellness is a priority for people with multiple sclerosis and can be achieved through health behaviors, including physical activity and exercise. Healthcare providers should endorse and promote the benefits, safety of exercise and lifestyle physical activity for every person with multiple sclerosis. International experts in the fields of MS, exercise, rehabilitation, and physical activity, physicians, nurses, physical and occupational therapists, exercise scientists convene that progress towards these goals should be gradual based on the person's abilities, preferences, and safety. The physical therapist assistant approach is hands on by leading the treatment plan developed by the PT while observing the patient's ability to perform the interventions and reporting to the PT regarding the process.
Hi, I'm Doris, and my major is psychology, and I will be connecting behavior and the environment. Behavior adapts naturally over time, shaped by consequences in a way similar to evolution, allowing change to occur without relying on internal reasoning. This evidence based perspective supports learning, personal growth that is empowering, meaningful, and grounded in observable principles. Applying these ideas aligns closely with our group's mission of providing compassionate, accessible care that addresses physical, cognitive, and emotional needs while promoting holistic well being, fostering innovation, and encouraging a lifelong journey of learning.
Hello, my name is Isis Oriana, and I am majoring in animal science to become an animal vet. As someone who is majoring to become a vet tech, it's important to acknowledge the importance of animal care. My slide shows how important the care on an animal can be to us as the world itself, and vice versa. By seeing the eyes of Erik Erikson's theory, you can see how important the connection of a human is to their pet and vice versa. Animals can help diagnose sickness in children like diabetes, cancer, and Parkinson. They also help the blind and people who can't mend for themselves. As and we as humans can do our part as keeping their homes safe from pollution and offering aid. When we come to understand how to take care of them, we also can help ourselves. We know that the cost of having a pet can be a big one, and that's why I would like for you to consider these things before getting a pet or giving one to someone. Can they afford it? Are there liabilities that they have that can help them prevent this animal from being sick? Do they have resources of which they can tend to for food, for other stuff? Um, for Eric's theory, you can see how trust and untrust is seen in earlier puppies. You can see that as in wild animals when we come rescue them from the world and how they trust us after they leave. You can, the ways that we humans and pet owners can help make lives for our pets easier is by looking into free center clinics that many times provide beds, shots, and food for animals. Or if one of our own pets are done using a toy, or if they're not eating their full meal, we can also offer that. From the research in my essay, I was able to see how children and animals, pets, have come to live with each other and learn and evolve in their own ways with each other. We know that humans depend on animals more than animals depend on us. However, the sickness that animals have is much harder and expensive to determine there because there is no way for them to tell us what is wrong without doing many tests. The cost of these tests and medicines sadly are the reason why there aren't many mass productions and clinics that are able to have these resources. I hope that my slideshow was able to present a different way to view our animal versus human care.
Hi, my name is Gavin Klein. I am a pre-health occupations major, planning on going into nursing. I wrote about research done on qualification, training, and integration programs for immigrants in healthcare. And immigrants and refugees have seen a very dramatic increase throughout the 21st century. A large percent of those immigrants and refugees are very highly skilled, highly educated workers in specific disciplines such as healthcare. Um, Oftentimes, they're offered opportunities to work in their host country, but they typically face a lot of barriers, a lot of struggles, especially because of language barriers and differences in standards and practices. It's an especially big problem in the healthcare industry. And the article that I read was an observational and analytical study of various integration methods that were designed to increase language comprehension and proficiency, as well as self-confidence skills, and kind of bridging the gap between immigrants or refugees' host country and their country of origin. Um, these programs would last anywhere from 2 days to 2.5 years, but even short 2-day programs were found to be very valuable, valuable enough to make a difference, like a noticeable difference in these workers, especially in language comprehension and just overall self confidence. And some of them as extensive as 2.5 years made drastic differences. Um, and these programs are an essential tool in integrating migrant workers into the differences of a host country's healthcare practices and systems.
I'm Mari. My major is nursing, and on this slide, I want to share with you what researchers found about how parents' behavior during play affects young children's language development. A team led by Rivera studied 90 little children aged about 15 to 31 months along with their parents. They used a special tool which watches how parents interact with kids during play and how this affects the child language development. Researchers show that positive and warm parent-child interaction, things like showing enthusiasm, making eye contact, giving encouragement, and responding to a child's action, help children learn more words and feel confident. And it's not just the amount of talking that matters, but the quality of the interactions. Children learn best when they feel emotionally supported and motivated to communicate. Children's language was measured with standard development tests, receptive tests, this means what child understands, and expressive test, what child says. What researchers found when moms and dads encourage their children, letting them explore, giving them freedom in play, and this predicted about 18% of differences in the children's ability to understand language. When moms were responsive and reacting to what children do and teaching them, it predicted about 60% of differences in children's abilities to speak and use language. And researchers highlight that both parents matter because different roles support different skills. Mothers' responsive and teaching behaviors help children speak more words, while fathers' encouragement and teaching help children understand words. So, what does it mean? It shows that a child's language development depends not on just on the time parents spend with them, but also on the environment around them. Simple actions like talking while playing, encouraging the child, naming objects, and responding to their interests can make a big difference.
Hi, my name is Mark Lanson, and I'm a psych major student in Sacramento State College. My slide is the mental health and grace in healthcare. As a healthcare provider, it's also very important to understand and know that CPTSD or complex PTSD and PTSD or post traumatic stress disorder is an ongoing and widespread problem that contributes to one of the leading causes of death, which is specifically suicide. From the article that I read, depending on how severe abuse is in someone's childhood, it can be a strong association or link to greater chances of suicide. And this is not just tied to one culture. As a study from the article that I read has proven in previous studies that happens worldwide, as is the case in the four countries. The study that took place in those four countries include the US, the UK, China, and Malaysia. Learning to help understand others and give them grace and empathy is potentially a huge step in curtailing the chances of someone taking their own life. This is especially for those who have trouble creating and maintaining healthy and stable relationships, which is one of the common symptoms of abuse from childhood. And so, to kind of give more of a further information, when it comes to the four countries, from what I understand, excuse me, bear with me for a second. Complex PTSD, or not PSD, is strongly associated with suicidology. Individuals meet criteria for complex post-traumatic stress disorder, which is CPTSD for short, scored significantly higher on suicidality than those with no PTSD or CPTSD and those with PTSD alone. The findings were consistent across all the cultures, like I said in the slide. And it did not differ by region, especially between West countries and East Asian countries. And so clinical implications includes standard PTSD treatments, which includes TF, CBT, or EMDR. It may not adequately address symptoms related to suicidology because of complex PTSD. CPTSD specific interventions include emotional regulation training, interpersonal skills, self-concept work, which are all needed, and screening for both CPTSD and childhood maltreatment is essential because both are often underidentified in clinical settings. So, in conclusion for my slide, CPTSD uniquely elevates suicide risk among adults with histories of childhood maltreatment, and treatment must specifically target these symptoms to reduce suicidology. So, in conclusion, healthcare is a service that everyone will need to seek at some point in their life, typically during a time of despair. Considering this, how we interact with our patients, we should keep in mind that they should be treated with mindfulness, empathy, and respect. And to add further considerations, understand Erik Erikson's 8 stages of psychosocial development is especially important when interacting with patients and clients. Different stages of psychosocial development present different psychosocial crises, so understanding what stage or age range they are in, especially with the client, is helpful to know what the best way to approach the treatment is for them, especially contextually. So, moving on, this is our bibliography or our works cited reference pages. All of our information on our presentation are on these slides. Or, sorry, not slides, are on these reference points here. So going on to the next page, these are the rest of our works cited. Give it a few minutes, or a few seconds, I should say. Take your time to read it. Pause if you need to. This is our presentation for our Psych 370 class, Human Developmental Lifespan. We're the Bio Group, and I would like to say, have a nice day, have a good night, and take care of yourselves. And give yourselves grace if you guys are going through a lot, depending on who you are.